Okay, good morning again to all of you. First of all, thank you, Jenny, for your kind introduction. Thank you to all of you for coming today. Why? It makes our effort worthwhile. It makes it worthwhile because I don't see just you. I know that you have friends and you have families, and I hope that you can share our information and our messages with your friends and family. I'm the president of the Society for Continence. So as Jenny said, I'm a volunteer. In medicine, when we say volunteer means I tell you to do, you are now volunteer. Okay, so I was volunteered. But I was volunteered when I was a trainee because my boss said that you one day are going to have to learn to look after people with bowel control problems. I said, wait, I thought I'm coming in to be the world expert on cancer surgery. He said, no. They said, you are now volunteered into this. So that was the beginning of my path in medical volunteerism. So when you hear in the news in the future how the ministers say, wow, all these medical volunteers very great. Now you know. It's because the father, his boss on top said, you are volunteered. But jokes aside, I realized that it's very meaningful, and it really helps when you can give some sort of support or help to treat a problem for a group of people that to me has still been overlooked or put aside by society. So today I'm very lucky because we've had so many good speakers. People who have also spent their time with the society, not just to give these talks, but to also to volunteer to organize other events for us, primarily hoping to educate the public about incontinence as well as all other pelvic floor problems. And then from there, hopefully to help some of these people who are suffering from it. So as a colorectal surgeon, meaning I deal with the back end. That's why as a speaker, I'm the back end. I'm the last one. Okay, so today I'm supposed to talk to you, and I purposely made this talk more about constipation and lifestyle changes. So you think about it, that's the opposite of incontinence, right? One is cannot let go, one is cannot control. Now I'm saying you cannot let go. Why? Constipation is also a type of pelvic floor disorder, as our previous speakers has alluded to, right? If you have constipation, you also have urinary problems. If you have a pelvic floor problem, actually if you have a weakness of your pelvic floor muscle, it's more common for you to have problem passing motion than to have problem holding the motion. Okay? So this is actually a more common problem, and it's part of the whole condition. But the more important thing is that when I was training, one of the first things I learned in surgery is surgery for constipation. Today is one of the few things I do not have to teach, because we should not operate on constipation. And most of the things are done through lifestyle changes. So what do I mean? So I'm just going to quickly run through with you is what is considered a normal bowel movement. And then, are there different types of constipation? And this part is only useful if you want to show your friends you are smarter, right? Your lim kopi, okay, cannot say lim kopi. When you drink your decaffeinated coffee with your friends, or you now got to go more, as Dr. Rana has said, we go more atas, we go lim at this Ang Mo Cafe, we don't go kopitiam, right? Because less caffeine. Okay, but the idea is that there are different types of constipation, but it is also important for you to know a little bit, because if you suffer from one type and you think your pattern is more towards one type, it's a slightly different treatment for each type. Then next is what causes constipation, and this is where the lifestyle then changes will come in, because it's about how you overcome them. So a normal bowel movement, first of all, every day when there is food that enters the stomach will send a signal called the gastrocolic reflex to the large intestine, okay, to stimulate the large intestine to wake up. If you think about it without knowing science, it's very logical, right? Here something go in, I must make space from the bottom for things to go down. So it's very logical, all right? At the same time, when you wake up, within 30 minutes of you waking up, the colon itself also naturally wakes up. There is a morning signal waveform, we know, that will create a movement of the feces towards the anus. That's why most people pass motion in the morning. But this gastrocolic reflex, the easiest way to understand is if you look at every person who is a mother here, you know, you feed your baby, especially, okay, infants, first year, you feed the baby, within 30 minutes, pangsai. Why? It is the gastrocolic reflex talking. Okay, but this reflex is inside all of us. It becomes quiet when you hit about 2 to 3 years old. And that's why in adulthood, most of us pass motion once a day, primarily based on the colon's natural wake-up pattern. And this is important because if any of you had any disease, say a severe infection, food poisoning, you notice that after that, for the next few days, when you eat, you also still feel the urge to pass motion. That's because when there's a disease or surgery to the stomach or the large intestine, this gastrocolic reflex becomes active again for a while. Then it settles down again. Okay, if you've seen any of your friends who had their colon operated on, say, okay my area, colon cancer. After that, they'll tell you they pangsai a few times a day for a few weeks. Then it goes back to normal. And that's because the gastrocolic reflex wakes up. Okay, so all of you have it, but all of you have a silent one unless there's a problem. Okay, so this is important to know about what a normal nerve movement for normal bowel movement. So when you wake up, the nerve signals wake up. Then when the stomach is distended, either with food or usually with water, the signal goes to the colon, it contracts, the gastrocolic reflex, the colon then pushes the stool to the rectum. The rectum feels full, is distended. How do you know? You feel the fullness in the buttock, not in the tummy, but down below. And then that signal tells your brain it's time to go. Okay? And then the whole sequence of the bottom movement will then start, which we will not talk about. Today we're talking about the colon's movement. So your colon, just to quickly understand, there are two types of muscle contraction in the colon. Okay? In this picture here is this term called peristalsis and the other one called segmentation. So what does that mean? Segmentation means that the colon contracts only in parts, but all the parts are contracting at the same time. So what it does is that it moves the feces back and forth. The idea is to allow mixing. Mixing allows time for you to absorb water and all the content. But peristalsis, on the other hand, is the one I mentioned just now, the sequential waveform moving contracting the colon, moving all the feces in one direction only towards the anus, the rectum and the anus, to induce your bowel movement. So this mass movement with the peristalsis happens twice a day, most of the time. Most of us pass motion once a day, right? Okay, some may be more, some may be less. But why then do I say mass movement happens twice a day? Most of us don't pass motion twice a day, right? That's because if you've cleared most of the stools in the morning, the mass movement is still happening, but you don't get the urge to pass motion because not much reach the bottom. That's all it means. Okay? So the normal defecation process. Okay, what happens? So first of all, stools or the sign must reach the rectum. Then you must, when it reaches there, it stretches, causing the anus to relax a bit. You feel the fullness, and you realize another thing. You can tell whether you are going to pass wind, whether you are going to pass solid stool, or whether you think you are going to lao sai. Right? The reason you can tell is because when the feces reaches the top of the anus, there are sensors there to tell you what is coming out. You can differentiate. So that's what we mean by anal sampling. Okay? So your brain is quite good. Some people are affected, especially diabetics. One of the first nerves to be destroyed by poorly controlled diabetes is the nerve that allows you to tell what is coming out. Okay? Then after that, if you find that now is not a good time, you sense already, oh, I want to pang pui. You are inside this room. Somebody is sitting next to you. Somebody that you don't know, so not your best friend. You don't want to make yourself look bad in front of them. What do? You will then squeeze your anal sphincter, as Rachel shared with us earlier. Why? You don't want to let go. Right? That is how you control. So I'm not talking about letting go, just how you control. So that is the normal one. So now, what is constipation? Are there really more than one type of constipation? So now the next slides don't have to remember anything. It's only for doctors. But I brought it up to tell you that sometimes doctors talk. They don't talk to patients. They talk to themselves. Okay, meaning they like to hear their own words. Right? So this is when doctors like to listen to themselves. So there are, broadly speaking, for us, 3 types of constipation. Okay, one is, and most people have, is what's called chronic idiopathic constipation. Chronic because there's a full way to define it, but that the primary problem is your colon is slower, and the problem exists for more than 3 months already. Then it's called chronic, and it's idiopathic because it belongs, the condition starts from within the colon itself. Acute idiopathic constipation, everybody experiences it sometime, meaning one episode of very, very hard stool, maybe you didn't pass motion for 3 or 4 days. Okay, it happens a few times only, and it's less than 3 months problem, is called acute. Secondary is the other big issue, and usually it happens because of medicine. Many of us are on medicines for various conditions. Okay. As earlier Dr. Rana mentioned, cough syrups, sometimes if they contain caffeine, can cause a problem with sleep. We also have a lot of cough syrups that contain codeine or cough suppressants that actually cause constipation. Okay, some people have hormonal disorders. If you have a thyroid condition and your thyroid hormone level is low, called hypothyroidism, then you can develop constipation. If you have Parkinson's, you have other nerve conditions, the nerves themselves can be affected and slow down. Of course, your movement slows down. Everything can affect constipation. So the bottom end, of course, will be affected. It's like the joke that which organ is the most important? The brain, the heart, the kidney, and the anus are chatting. Okay, the brain says, I control all of you with all my nerves, right? Therefore, I'm the most important. The heart says, I pump blood to make sure you're all alive. I'm the most important, right? The kidney says, without me, you cannot get rid of your waste products. Okay, I clean your blood system. Therefore, I'm the most important. The anus, he just shuts up. Brain cannot think, heart cannot pump, kidney cannot work. The anus always wins. That's what our colorectal surgeons, we always joke. So I had to say that. Okay, which is the background of constipation. So again, scientifically, constipation, chronic constipation, idiopathic, is that you must have at least 2 of these symptoms for more than 3 months. Wow, very complicated. But in reality, for all of you, constipation just means bowel movement less than your usual pattern. And it is difficult, it's harder, and you get other symptoms such as bloating, pain in the anus, or hard stools, difficulty passing. And that is very true. Most of us actually use this definition in practice. Okay? Why? Because it's affecting you. Therefore, it's a problem. You have a problem, my job is to help you solve the problem. So, going back to the original diagram of how the nerves work, so what can cause constipation? What Dr. Rana said. Okay? Nocturia, all this insomnia thing, if you have a disordered sleep, you will be constipated. Guaranteed. Sleep time is the time of your bowel to repair as well. So your bowels don't get to rest, it will be angry with you. Okay? Like a child that's mangchang, right? Throw temper, it doesn't want to work. your colon will shut down. Why? The nerves do not recognize your usual day and night pattern already because your sleep pattern is abnormal. So it's important to have good sleep. If you have hard stools always heavier and therefore move across the colon slower. Reaching the bottom slower require more effort also for you to evacuate. So hard stools can come from you having lack of water at the right time. Meaning what? One example of something I learned, it was something called hot yoga. I didn't know hot yoga until the patient presented to me with his constipation. So what they do is that they do yoga in a sauna setting. They don't drink water. They say, after that, very good. Why? I lose weight. Of course lah, you dehydrate. Right? Because it's a very hot setting, so you sweat a lot. But then in his group, they're told not to drink water. So that they can see that immediately after the exercise, they weigh themselves, they are lighter. But that's because they dehydrate, not because they're healthier. So of course he comes with constipated hard stools. Right? So his treatment was change exercise, actually, in the end, because everything else about him was normal. It's just that he took on this new exercise regime and he didn't think that was the cause of his problem. So having hard stools for other reasons will then, of course, cause the constipation. Of course, constipation itself causes hard stools. Okay? So back to that, inadequate water intake, right? So like I tend to believe what Dr. Rana says, you need to have enough water at the right time. You don't need to kill yourself like, I must drink 3 liters today. A very hot day, but if you're at home in an aircon setting, you don't need so much. But if the hot day, you go out and you're going marketing, you have to go and do a lot of other things that whole day and you're sweating a lot, obviously you need to replenish and drink more. So if your urine, you're able to pass every 2 to 3 hours, the urine color is clear or very light yellow, it's okay. Don't kill yourself. Don't have to punish yourself because you didn't drink enough or say anything. Okay? Life goes on. If your colon muscles are weak, you get constipation. Some people, the colon is slower than others. And that's expected. A small proportion of our population will have this. If you imagine your normal bowel habit, if you think of where you are today, now you think of where your bowel habit was when you were 20 years old. Of course, recall is not perfect, but you probably had an easier bowel movement when you were 20. When we hit about the age of 40, a lot of things about our metabolism does start to change. And we will not, and also affected by your lifestyle and your diet at that point in time. And what we realize is that every 10 years of your life, from the time you're 40, your colon will slow a little bit. Not enough to say pass motion from 1 day once to 2 days once, not so fast. But it's very gradual. Okay, and you might start noticing that change happening. Okay, so part of that is aging. But some people, that aging happens earlier. Like, I like to think I'm not so old, but I started balding by the time I'm 30. Okay? So some parts of you age faster than others, just live with it. Okay? So some of us, the colon ages a little bit faster and it slows down a little bit faster than the rest of the body. And that's fine. But for that group, then the treatment is slightly different. So some people have abnormal anal sensation or the muscle coordination problem. All this, again, you only know if you see the doctor. But the point is that there are many, many different causes that cause you to have difficulty passing motion. But the majority of them can be overcome or at least controlled to a great extent with lifestyle changes. So what are these lifestyle changes I want to talk to you quickly about? So you know, first one, good sleep. Okay, I won't have to say too much. So good sleep always helps. Drink a lot, drink enough water, hydrate well, always helps. Okay? So not into specifics, but the idea is that you know that you need to sleep enough for yourself. Okay? You need to know that you need to drink enough for yourself. And now, one trick you can do if you think you're constipated, earlier I told you the gastrocolic reflex. So you want to stimulate the stomach when you wake up in the morning. Don't need to be like that. That's the only reason on the photo. But I have one patient who actually was suffering from constipation. After everything, we use medicine, we do a lot of things. In the end, he said that the one thing that helped him the most was that he drank 1.5 liters of water in the morning in 30 minutes. I looked at him and said, "You didn't vomit?" He said, you see, for a person who is suffering from constipation, this is the lesser evil. Because once he drank his 1.5 liters, it triggered his morning waveform. So your morning, you wake up, I told him, make sure you wake up early enough so you don't feel like you are rushing out of the house. I said, okay, Ken, I did everything, but nothing seemed to have helped, so he drank the water. Because I told him about drinking enough water. But for him, his trigger was 1.5 liters, which is extreme. Okay, most of us, you drink 1 or 2 cups of water, it will trigger already. But the important thing is, when you wake up, drink something. Okay, it doesn't matter whether it's cold or warm. Preferably not cold, I must say. Some people really don't respond well to cold water. The stomach contracts, they feel uncomfortable. Warm water or tepid water, room temperature is good enough. Okay, when you do that, you will stimulate the stomach, and then the stomach will then stimulate the rest, the colon, and then the whole waveform will start. So it's the gastrocolic reflex. So when I say it doesn't matter whether it's warm or cold, that's up to you. Whatever works for you is the correct one. Okay? So, sleep well, drink enough, drink in the morning, eat well. Okay. Everybody say must eat properly, right? Then what's all these things about? All these weight loss things. Intermittent fasting. This Atkins diet. All this diet there. The easiest is you look at all the doctors, or all those who tell you to do, all the doctors like easy. They don't do all this one. All 乱出来 one doctors. Okay, why? Because it's about control and discipline. Volume is important, okay, but also types is important. So earlier, Rachel talked to you about like the food diagram, right? I remember it's a half quarter thing. All right, which is that 50% of your diet should be comprising of fiber material such as fruits, vegetables, nuts. Okay, 1/4 on protein, 1/4 on carbs, and the rest. So when we say vegetables, why is it important? Now, specifically for people with constipation, the recommendation is that one serving is like 1 handful, or if you go to buy economy rice, that 1 serving. Okay, or one item. That's more or less 1. Okay, the other way of looking at it is 1 serving is also roughly equivalent of one small apple. Okay, that's the size, that's the amount. Now, if you aim for at least 3 servings of vegetables a day, for people who take less than that, we aim for that. For people who are already reaching that, we don't ask you to take too much more. All right, and also fruits specifically. Now, we are very lucky and unlucky in Singapore. Lucky that we get a lot of types of fruits that are generally going to help you pass motion. Why it's unlucky is all our fruits are imported, so very expensive. But why? Fruits that are sweeter, they actually either contain sugar or the chemical that gives the sweetness is actually a laxative. So papaya, for example, even your grandmother knows, right? Papaya will help you pass motion, right? Why? The chemical called papain actually is not a sugar, but it actually stimulates your colon to contract. All the other sweeter fruits all have a similar property. But you must take it as a fruit, not as a juice. If you juice a fruit, you separate the sugar from the rest of the fiber, your body absorbs the sugar too fast. Okay, and it actually now reverses. Your small intestine detects, so much sugar coming, I want to take all the sugar. It slows down in order for it to absorb sugar. So people who take a lot of simple sugars, drink bubble tea, which is the younger groups with all the constipation, I have to stop them drinking bubble tea. Or bubble tea reduced from 100% to slowly to 50%, aim for 25% sugar. And then when they can hit 25%, I tell them it's time to stop sugar completely. Why? Because added sugar creates problem. But the fruit sugar, because it's within a fruit, as you eat it, you don't absorb a lot of the sugar. Part of when the sugar is not absorbed and it reaches your large intestine, it becomes a laxative straight away. I'm not sure whether any of you had taken a laxative called lactulose before. Very sweet liquid laxative. Okay, polyclinics give it out readily because it's super cheap. But how lactulose works is that it is a sugar that your body cannot absorb. So when it reaches the large intestine, it irritates the large intestine and it behaves as a laxative. So fruit sugars work in very similar properties. If they reach the colon, they are laxative. The problem is, can they reach the colon? So if you take a whole fruit, so one serving of fruit a day, it helps to prevent it. Okay? So enough diet in your fiber means your stools are soft. If you don't know how much, then aim for 3 servings of vegetables a day, 1 serving of fruit. As a rough guide. Huh? The assumption is that most of us eat 3 meals a day. So the other thing that's helpful, colors. Okay? Colors because of all the other nutrients. And when you don't know what to do, just choose different color. Then eventually you will, by luck, you will hit something right. Oh? Okay, exercise. Okay, exercise important. Regular. Regular exercise doesn't mean every day. Okay, never listen to gym instructors. Because he is too young. He has too much muscle. He doesn't know what you want and what you need. He is telling you instruction to live his life. Sorry, my personal take on gym instructor. So obviously I don't go gym. Okay, but exercise helps your colon with its natural movement. When we exercise, we want you to exercise in a way that is suitable for you. Some of us have knee problems, there are certain things we cannot do. Some of us have back problems, certain things we cannot do. But the simplest one is walking, because whatever problem you have, most of you can walk. And obviously, all of you who came here today walked. Okay, so therefore, all of you can do walking. Walking is low impact, it doesn't damage your joints much. I'm just talking about it as one form of exercise. But if you have other activities you enjoy, carry on. Okay? How many times must you do? You aim for about 3 times a week, a starting point. If you're already reaching 3 times a week, it's up to you to do more. But I'm just saying that if you can reach 3 times of exercise a week, generally that frequency is enough. So it doesn't affect your lifestyle too much. Then how long do you exercise? Okay, we want you to exercise to the point that your body is feeling tired. So you are breathless, you're sweating. Sweating not from the sun but from your exercise. So you're burning. Okay, why? When you reach that level of exercise, your brain also sets off a set of chemicals that makes you feel good and feel happy for exercise. Indirectly, the same set of chemicals also stimulate the body to repair muscles. And as it repairs, it doesn't choose specifically a muscle to repair. It's a signal for the body to repair. So what we realize is that even the colon's muscles get repaired and they move faster. So if somebody is not familiar with doing exercise and the first time they exercise, say they walk for 30 minutes, okay, they realize that it's not too difficult to walk for 30 minutes, but the next day the bowel movement becomes easier, straight away. The effect is quite instant. And that they just walk that one time, the bowel movement is easy for the next 3 days. And that's a very common pattern that we see, and that's correct. So you should exercise, but you don't need to kill yourself. Exercise must be suitable for you. The best exercise is always low impact aerobic, so walking. Okay? You can cheat by walking early in the morning or walking later in the evening so you don't have the sun directly on you. Then you cannot tell whether you're sweating from the heat exposure of the sun or you're sweating from your activity. Better to sweat from your activity. Okay? And then a lot of exercises also require a lot of movement. So racket games, very good because you're changing posture all the time. Swimming, very good. Okay? Because all these movements help to always only move all the stools in one direction towards the anus. And when you are breathless, that pumping motion pumps your abdomen and moves everything in one direction to the anus. Okay, so all these things help. Okay, of course, exercise has so many other health benefits, everybody should do it. Okay? So, last thing is, earlier, Rachel also mentioned, you must answer nature's call. Okay? Why? Your colon sets off that contraction, right? If you avoid it, if you hold back for too long, what happens is that the rectum senses that it can contain more, so the signals will drop. So if the rectum is not ready to push the stool out, meaning you don't feel that feeling that you want to pass motion, and I ask you to go and push the stool out, it's actually very difficult. The majority of the work is done by the rectum when we push feces out, meaning the contraction holds all the feces pushing towards the anus. Your job is just to open the door at the anus. Then it finishes the job. But if you go in and you open the door but upstairs don't want to come out, nothing will come out. Okay? So answering nature's call is important. The timing is based on when your body tells you. Okay? When people say you train your body to pass motion at the time, it doesn't always work. Not everybody's bowel moves exactly at the same time. Of course, what I've talked about, sleeping well, eating well, exercising, drinking well, all those things help to push you to the optimum time for your bowel to wake up. Okay? And that if you postpone your bowel motion, say from the morning one to the afternoon, you expect it to be harder. Then the harder the feces, the harder the motion. And you cannot force it when there is no urge. What will happen? You can get your pulse will swell up, anus will be in pain, there might be some tearing of the anus, some bleeding. So earlier, again, you see a lot of things I say also, like what Rachel has said. Good toilet posture, okay? So, good toilet posture, like we watched in Jackie Chan last time, Zha Ma Bu. So, why is this posture important? Number one, if you are in this, okay, ideally a full squat. A full squat opens the anus the best. But a full squat can be problematic for us as we grow older because of our joints. It's also problematic for people who squat all the time because they are more prone to developing piles. Okay, because you open your anus maximally. So and in Singapore, we are getting rid of squat toilets. So how then do you do a squat? It's actually a semi-squat. So as you said, the hips, okay, the knees are higher than the hips, right? Then we want you to lean forward and put your elbows on your knees. Why? When you put your elbows on your knees, you are creating this forward angle. When we say bulge abdomen, basically we are asking you to push down. But also the last important thing is to straighten your spine. So earlier, like Rachel mentioned, if you are sitting curved back, you try and strain down, the pressure goes everywhere. Reason being that if your back is curved and you push down, the tummy is a circle in a sphere, okay, like a ball. In a ball, when you press, pressure generates everywhere. But if your back is straight, and how you straighten your back is, you open your shoulder, naturally your back will straighten. Automatic. So don't think about your back. Open your shoulder, put your hand on your knees. Immediately you are leaning forward and your back is straight. Okay? What that does is that when your back is straight and you strain, how we strain is that we squeeze our diaphragm down. And your front is contracting. Front contract, top contract, back is locked, all the pressure is below. You don't have to work hard. The posture is to make it easy for you to push the feces up without having to work hard to kick. Okay, so good toilet posture is very important. Okay, good position allows you efficient production, less straining. Okay, less straining means also less problem with hemorrhoid, anal pain. So, in summary, many types of constipation. I only mention it because doctors like to talk for themselves, not important for you. In all cases, remember, lifestyle and dietary changes are the key to reducing the severity of the constipation and also help to prevent constipation for most people. And the good lifestyle practices, okay, with people with normal bowel movement also helps because you don't want to start developing a problem. And with that, I'd like to thank you all for your attention. Thank you all for coming.